Hearing is a key aspect of senior health, and it is so important for seniors to review their plans now during the Medicare annual election period to make sure that they get the care that they need. Well, we have Dr. Jurani-Suarez from Healthcare Partners. She is here to explain it all. Welcome to the show.
Thank you so much for having me, Mercedes.
We need to get some information from you because this can be a very confusing time, whether you're a senior dealing with this or if you are taking care of a senior. And so tell us, what should seniors be aware of when it comes to their hearing health?
So hearing is a very common problem that occurs as we get older. In fact, 1 in 3 adults from 65 to 74 have difficulty hearing. Over age 75, approximately half of people suffer from hearing loss and may not feel comfortable enough expressing that. And it's important for those around to be aware of those possible symptoms that may have some hearing loss concerns.
That is so surprising to me that many people experience loss over 75. Now, what are some of those signs that they are experiencing that?
So someone that may have difficulty following a conversation if more than 2 people are involved, having difficulty following the conversation, especially if there's background noise, having to turn the TV up so it's uncomfortable for other people in the room, having to repeat yourself. And again, the seniors can feel very embarrassed to discuss these things. During this time of annual election period, it's important to discuss hearing concerns early on and possibly get on board with plans that may help with hearing evaluation.
And the plans are so different. Do you know that some include exams, some include ongoing treatment, things like that? And that's really important to kind of get that information ahead of time and not wait until the last minute.
True. Now, traditional Medicare may not actually include hearing evaluation coverage for hearing aids or hearing aid fitting.
Okay.
But there are some Medicare Advantage plans that do have additional hearing benefits. So it's important to talk with your provider about those possibilities.
I did not know that. Now, when it comes to what does Healthcare Partners recommend when it comes to making sure that seniors are taking care of their hearing health? Is there anything that they can do?
So certainly speak with your provider as early as you are realizing that there's some concerns. During this time of annual election period, getting on board with updated information regarding your plan that may have some additional benefits. The My Generation clinics is something that Healthcare Partners has available, where there are care coordinators, care navigators that can help get you on the right plan and help coordinate and navigate through complex healthcare system that we are in.
When you have a patient that you think is experiencing some hearing loss and they almost don't want to admit it, I know that it has happened with some older people in my family when they don't want to admit that they're getting older and things are declining. How do you bring that up and say, okay, look, it's okay, it happens to everyone? It's a sensitive subject sometimes.
It is something very common, and it's a matter of being open and asking questions about that. In a traditional clinic or in our comprehensive evaluations, that's one of the standard questions that we ask about that. And it's something as easy as looking in the ears and making sure there's no wax and helping to maybe clear that. But again, with evaluations, there are good benefits out there that can help in that coverage.
Such great information. Thank you so much, Doctor. Seniors, you should consult with your doctor and insurance provider to get the best route to hearing coverage through a Medicare plan before the Medicare annual election period ends. That's on December 7th. And if you need more information, just visit their website, experiencehcpnv.com, or call them at 702-766-0486. Courtney, over to you.
Thanks,